the families who have experienced such grief and such loss since the extraordinary tragedy on Monday, and that today was all about reuniting them with their loved ones. We know that reunification won't ease that sense of loss or grief, because I don't think anything can. But we felt an enormous duty of care as New Zealanders to make sure that we brought their family members back. Our focus has been making sure that they receive the very best immediate care that they need in the aftermath of this tragedy. I've visited some of our health services. We have extraordinary health professionals in New Zealand, but at the same time a desire to make sure that loved ones are able to be close with their loved ones who may have been injured. There has been a process, particularly for those from Australia, not least because of the proximity. Over the coming period of time, we've managed to medevac all, as I understand, but one will over, at least if they have not already, will over the coming days be repatriated, medevaced to Australia. For others, at this stage, I do not believe there are other plans in place yet, but till that time, they will be in the very best of care here. This is a volcano that has been visited for the better part of 30 years. However, we also hear and absolutely agree that there are questions that are being asked that must be answered, and they will be. As has already been said this week, WorkSafe is the agency in New Zealand that will hold responsibility for that, and as you'd expect, where you have significant loss of life, a coronial inquest as well. And those are the processes that will allow us a space to answer those questions, because of course they must be answered. I want to ensure, though, that no one predetermines anything in this time and place, that we allow that work to be done properly, and that we give those experts the time to do that, and that we also respect just the phase that we're in now, where families have only just had their loved ones come back.